And some of these techniques are going to mimic massage techniques too, but again, people have their clothes on, so you're going to have to use, again, more friction, compression techniques to actually stimulate these areas then. And some of the techniques that you can actually use for deportment-wise, you can go like this. Make sure your wrist is relaxed whenever you're performing this. Or you can have both like this. They call it quacking. Okay? So this is hacking like this, alternating. Quacking is like this then. Okay? And some people actually kind of do a diffused, so you can actually go like this. But again, in the kidney region, floating rib region, make sure you don't put a lot of pressure in that area. So even when you're going over, just you can back off the pressure a lot, just to keep that fluid. Because if you go like this and then totally stop and go to a different area, it's going to get a little bit abrupt that way then. So again, you can actually kind of twist your thumb too, okay? And just have more of the pad of your thumb, if you're using just your thumb like this, and just see what works better for you. But when you go like this, as you can see, it's kind of hyperextending the thumb here, so you're more likely to injury, especially if you're adding pressure then. So kind of have it close together like this. Works really nice. And it all depends how flexible you are for these kind of techniques. So you can actually go up the body, you can actually go here, side, and then flap it like this. So like this. So you can get both the sides of the body this way then too. Just going up there. So again, in the kidney region, just make sure you concentrate, not a lot of pressure. Because that's why in boxing they actually say no kidney punching, just because you can actually urinate blood then if you get a lot of deeper pressure right in that region. And people can actually get bruised kidneys too then, okay? For like the arms, you can always incorporate the arms in this region. So you can also grasp, just grasp these areas. And you can also kind of lean down, and if you need to, put your knee on the table, kind of push down throughout the body too then. But again, with Shiatsu, make sure you follow the meridian lines as much as possible. But in general, if you don't want to say it's actual Shiatsu, again, you can call it, you can just table massage with clothes on, or Shiatsu American style, whatever feels more comfortable for you. But the thing is, when you say Shiatsu, they're going to expect you to know a lot about Asian medicine. They'll actually ask questions, so make sure you back that up then as much as you can. Okay, next one, what we're going to do, you can actually, their arm over the side of the table like this. You're just going to sit on the table like this, have this wrapped over like this, and you can actually compress areas like this then, okay? But for women that have larger breast tissue, just make sure you're not sitting on that, of course. Be aware of what you're actually doing then, okay? So you can actually get a lot of the tricep region too. Get the meridians that way. So again, with compressing, you can use different time frames. You can actually push in slowly, come out slowly. Push in slowly, come out slowly. And you can just get a little bit deeper each time too, okay? So you can, more of a rocking method. So again, some people just do it really slow like this, and then slow out. But usually the slower you go, it's going to be a little bit less painful, and less jarring too. So they can actually just rock it back and forth then to perform those techniques then. Okay, and then you can also walk the back. So walk, so even pressure throughout. So again, you can have your knee on the table too. So that's why Shiatsu tables are a little bit wider too. And again, they're going to go down really low to the floor, so it's more comfortable for you to get your knee up on that region. So you can also kind of push into the body. All these areas you're kind of pushing in. And again, this is just for demonstrational purposes, but you want to make sure you even out both sides as much as possible at all times. And just make sure you're usually going to have more of a dominant hand. Make sure you use the other hand on the other side, just so you don't overuse that one hand when you're performing these kind of techniques. You can even walk the body with the knuckles too, going throughout. And again, you can just stay in an area 3 times.